So I'm showing you now the heart from a child of about 10 or 11. It's an intact heart, and I've positioned it so that it lies as it would be within the body. You all know that the long axis of the body is vertical. You see that the long axis of the heart itself is well out of skew relative to the vertical axis of the body, and the cardiac long axis runs from the apex of the ventricular mass up towards the right shoulder. With the heart positioned as it lies within the body, we can see the right border, we can see the inferior border of the heart, which lies on the diaphragm, and we can see the sloping left border. From the superior aspect of the heart emerge the aorta, from the center point of the cardiac mass, and the pulmonary trunk, which is anterior, superior, and left-sided relative to the aorta. Now we describe the heart as though it were a triangle, and that triangle is the ventricular mass. And of course we speak of the apex of the heart, which is the leftward point of the cardiac silhouette. But our focus today is on the atrial aspect of the heart. And then interestingly, when we look at this anterior view, that is from the front, all that we see is the right atrium. And the right atrium makes up the right border of the cardiac silhouette, with the superior cable vein entering at the top, the inferior cable vein at the bottom. To show you the left atrium, I have to turn the heart all the way round so that we're looking at it in left lateral projection. And now you see the left atrial appendage, which just peeps out round the side of the pulmonary trunk. The left atrial chamber itself, with the pulmonary veins coming into its four corners, is the most posterior of the cardiac chambers, that part towards the spine. Now, if I turn the heart so that you see it in left anterior oblique projection, you can see very beautifully that the cardiac or the ventricular part of the heart is squashed and has three surfaces: the sternocostal surface, the inferior or the diaphragmatic surface, and the part of the ventricular mass which lies in the notch of the left lung. There are then two important borders reflecting this squashed arrangement. The border towards the front is sharp, and we call that the acute margin. The border on the top of the heart is much more blunt, and we call that the obtuse margin. Notice that the inferior part of the heart, the part looking down towards the feet, sits on the diaphragm. And if I turn the heart and show you this part, then this is also a very important area. You're now looking at this undersurface of the ventricular mass. This is the obtuse margin. This is now the acute margin. And you see that the ventricular septum, marked by the descending coronary artery, is in the middle of this bottom part of the heart. Here is the plane where the atrial chambers meet the ventricular mass. This is the atrioventricular junction, and there is a very important point where the inferior part of the ventricular septum meets this atrioventricular junction. This is the mouth of the inferior cable vein. So here is the position of the atrial septum, and the point where the plane of the septal components crosses the plane of the atrioventricular junction. This point is called the crux of the heart. And as we will see, that is very important when we come to consider the coronary arterial supply. So if I turn the heart all the way back, put it back into its clinical situation, the crucial points, the long axis of the heart itself closer to the horizontal than the vertical, the plane of the junctions closer to the horizontal, the right atrium, the only part of the atrial component of the heart seen in the frontal silhouette.